So our next presenter is hopefully in the room, Lynette. Okay, Lynette LaScala. Many of you may already be familiar with Lynette. If not, then you probably will be in the future at some point in your lives. Lynette is the founder of a very innovative center in the Los Angeles area called the NAPA Center. It's focused on integrative physical therapy and different skills and sensory activities for children with different levels of disabilities. And we've had many CDG families who have had the opportunity to raise their funds and to travel to the Los Angeles area and to meet Lynette's amazing staff, that we're just very grateful that she could come today and share an overview of some of the cutting edge therapies that they're doing.
Okay, sure. Thank you, Andrea. Thank you for having me. So usually, like you said, I'm Lynette LaScala. I'm the CEO and founder of NAPA Center. I usually present with Lisa Hickey, who is my rehab director, and she's at the Abilities Expo. So I'm on my own. So everyone's here been making me feel pretty comfortable. I did see a lot of NAPA families. So if I get stuck, I'm just going to have them stand up and tell you about it. Just joking. Okay. Thanks. So I'm the parent of a child with special needs. My son, Cody LaScala, had a near-drowning accident on his first birthday. And the doctors took us into that little room and told us that we should forget that we had him and go on with our lives, as I was pregnant with my other son. And of course, I was told he would never speak, eat, walk, talk, all those things. So it became my mission in life, as some of you, I'm sure, can understand this, to give him the best life possible. And I traveled around the world looking for very unique therapies, and that's kind of how I started NAPA Center. Cody, at the age of, I'm going to go through some of the therapies, but I'm going to give you kind of a brief history of Cody as well. So at the age of 18 months, I went to the Institutes for the Achievement of Human Potential, and I'll kind of go over that briefly. And then from about 5 years of age till 11 years of age, he had plateaued. He didn't make any progress. And that was the first time I found intensive therapy. He drove a power chair with his head, and his arms were fixed to his side, and he would just drive like this. He would still smile and have an amazing life, but he was just very challenged when it came to even using a joystick. So I did the first trip to intense therapy. I went to Mielno, Poland, and he came back beginning to do meaningful weight exchange, and after 9 trips he was walking with minimal assistance, and he was driving a power chair with a joystick, which if you ever tried to drive a power chair with a head array, it totally changed his life. At the age of 18, Cody had a neck surgery that paralyzed him, and he lost everything all over again. And 3 doctors said that he would never ever speak, eat, or walk again. And we started intense therapy again. He now lives on his own in Santa Monica. If you met Cody, you would say, oh my gosh, he lives on his own. But I told him he actually relocated himself from Iowa through United Cerebral Palsy and through the regional centers here. And so when I told them, but he doesn't feed himself, and they were like, oh, he has his caregivers lined up. And so he is living very successfully on his own with supports in Santa Monica. So I'm very proud of him. Okay, get to the speech. Okay. Cutting edge treatments and therapies. You want me to switch on? Okay. This one here? Yeah, space. Gotcha. Okay. Okay, so what you should take away, knowledge of different types of treatment techniques that are available. I'm not going to speak about everything, but a lot of them that I'm familiar with. And not every treatment technique works for every child. As we know, what may work for this child may not work for your child. What may work for your child may not be the best for someone else's. So how do you choose what is right for your child? Okay, Cody's journey, I kind of went over that through Euromed is where I took him in Poland, and that's where I became the US rep, and I would just go around the US and speak about intense therapy. So that was 20 years ago, maybe really old. So, and at that time, no one even heard of intense therapy, and it's really sad, it's 20 years later, and we're still there. which intense therapy it's life-changing to many, many children. And so that's kind of how I brought intense therapy to the US or to LA. So the NeuroSuit. We're going to talk about the NeuroSuit, CME Medic, Vital Stim for swallowing, Cage, body weight support system, and Oogle, AAC, augmentative and adaptive communication, hyperbaric oxygen, and the Institutes for the Achievement of Human Potential. I'm going to kind of watch my time to make sure. Okay. The NeuroSuit. Okay. The NeuroSuit is a tool that we use just to ramp up the benefits of intensive therapy and occupational therapy. It has three main purposes. It provides a load on the body to increase the upright response, and it corrects minor musculoskeletal alignments that you can actually realign the body, minor alignments. If you have a child maybe with the foot is turned out a little bit, you can bring it in with the suit, and then you put through the correct movements to correct the correct pathway to the brain. And then, what was the other one? And it's done in 2-hour blocks of time. It takes a while to get on the suit, so it's usually 12 to 15 minutes to put it on and take it off. So you need that hour and a half usually, or depending on the child, in the suit once it is on. And it provides proprioception to promote body awareness. And if I were to try to explain to you what it felt like to have the suit on, it's almost like someone's pushing down on your shoulders. So you can feel that weight on the body. So next one would be, CME and medic exercises. CME and medic exercises are basically the same thing. It was two people that developed this set of very unique exercises, and then they had a falling out. One went one way and called it CME, and one went the other way and called it medic. So that's kind of how we do it. But CME is a psychomotor treatment technique utilized by occupational and physical therapists to promote postural and motor control in children using a specific set of exercises. It specifically is utilized to promote postural response against gravity using increasing distal support, which means that as you see the child up on the boxes here, so what we're doing in this that slide over there would be we're creating the body. We're working on balance, but in an unplanned activity. This is where I wish I had my therapist here. But anyway, so when you're doing it, it's like this kid's obviously never ever done this before. So you're really challenging the body for higher level balance responses. That was good. She would be proud of me. So in this other exercise, I wanted to say one more on the top exercise. So when this child first started this exercise, we were more than likely holding him by the hips. And the hips, usually it's the hips, and then it goes down to the thighs, then they do the knees, then they do the calves, and then they do the ankles. Is that done in 1 3-week session? Not usually. So usually it's like they may be working on the hips the first intensive, and then the next time they can hold your child by the ankles or by the calves. So they move down gradually, okay? So the second set of exercises, this is the second slide. So on this one, they start with the child lying on their back on the massage table, and as soon as they pull them off where the head's gonna drop, they're gonna swing them around like this, and they're gonna stop them about right here. The vestibular system wants to straighten up the body, so we're working on neck control and upper trunk support in this one. So the vestibular system wants you to be upright, and you already have the momentum going, so once they stop swinging, like the child, after they do 2 or 3, you can feel the child, they'll hold them until they start popping themselves up. It's pretty amazing, which is Natalie Dragato here? She was, yeah. So we can all thank Natalie Dragato for NAPA having CME. And you guys may not know of her, but she's one of those crazy moms like myself that tried everything. And she really convinced me to bring CME from Argentina to the clinic in LA. And after I sent my first therapist and I saw what an amazing results we were getting, now we have 14 trained therapists at NAPA that do CME and Medic. They spend their evenings sometimes at 4:30, they'll get a group of kids and they just practice technique. And that's how they get really good at what they do. A lot of it's dedication, not just at the clinic, but on their own time. Vital stim treatment. So vital stim is a tool used by occupational and speech therapists in conjunction with feeding therapy for children with diagnosis of dysphagia. It's a form of electrical stimulation, the electrodes placed on the throat area, and the purpose of vital stim is to assist in strengthening and coordinating the swallow. There's a lot of hospitals that use vital stim. There are some other clinics that use it as well. We've been using vital stim for about 9 years, and we have about 9 therapists that use the vital stim. I still use it with my son Cody when I start noticing that he's drooling more, and it's not used for speech, but I always tell them that on the mom side, that I think that when he does use it, I do notice that his speech does get clearer, because if you're drooling a lot, and I know I'm not supposed to say that, my therapist would not like me telling you that. So it's used for swallowing, and it's also used to help children get off their G-tubes. Next one is the listening program. Okay, the listening program, and it's an auditory home program aimed at helping individuals who are having difficulty with processing sound information. These children may be sensitive to sounds, distracted by sounds, or having difficulty following verbal directions. The main purpose of this program is twofold: to help individuals' ear muscles respond more appropriately to a sound. That would be like if the child was overstimulated if they're hearing sounds, as well as help the brain change how it responds to and processes sound. The actual program consists of listening to classical music, 15 minutes, 2 times a day through headphones in between 20 to 50 weeks, depending on the program. We use it in therapy as well. We'll use it a lot when we maybe to calm a child down before we begin therapy, but it's also, there's a couple different listening programs or auditory program out there. Just make sure if you're going to try one, make sure that you're looking for one that is research-based, because there's a couple different ones out there that you could use. I didn't move my screens, did I? Okay, I guess I said that. A spider cage. So the spider cage is just what I say, it's just another tool that we have in the clinic. It's kind of, what we like to say is it just promotes a lot of hands. So you can see that if we were going to work with this child in gait training on the treadmill, we would need 2 or 3 people there holding his feet, making sure. So you can see that through the bottom bungees, that the bungees help align the feet as they're walking, especially if they're crossing over, or if you have one toe or one foot that's kind of pointed in, that we can take this, attach it to the shoe and bring it out. What else do I want to say about this one? Oh, so I think it also really gives them the feeling of independence. So if you have a child that, is doing great on walking, but yet they want someone holding them all the time, this is a way that no one's touching them, but they're actually standing by themselves. So they won't fall over, so it gives them the confidence of what it feels like to stand by themselves. So I think it really helps promote the confidence as well. Okay. There's another spider cage. Would you like to have fun here at NAPA? How many NAPA families are out there? 1, 2, 3. I got really sentimental when I first got here and I saw you guys all here. I was like, so many families. Beautiful. Okay, and this is the oogle. So it's used, this cage is used more with strengthening. So you see it's a series of weights and pulleys. So a child that may not be walking at the time, that we may use this. We used to use this all the time, but the problem is we have so many different tools that are better. So when we look at your child, we want to make sure that you're going to be with us 3 or 4 hours or 2 hours, and you want to make sure that you get the best bang for your buck. And so the oogle, which we used to use quite often, but now that we have CME in that, we don't use it quite as often. We use it maybe for some older kids that really need some strengthening of the glutes, and they're too hard to help for us to hold. So that's where we'd use that. And by the way, I want to go back a slide. So I had one of these cages in my home, so did a couple other people back there. But you could really create this yourself. And this belt, you can use a sports belt. You just can get creative. It's a great tool, and you could put a little trampoline under them, And it's like they're kind of doing their therapy on their own. But these are just bungees, the very heavy-duty bungees. We have smaller ones in this, but you can do it with just the regular bungees. And if you have a hallway, you could actually put the hooks in between the walls and where you could use it, and just make your own therapy tool. But it's great, and they really love it, especially if they have like the trampoline and they're jumping. It's providing that proprioception, and it's just something that you can do at home that you're not doing therapy. We don't like to do that. AAC, which I'm assuming most people are familiar with that, or maybe not yet. So it's technology used to help a child communicate. There's low-tech options like PECs and pods. We do low-tech, we do pods, we have pod-trained people, we also do high-tech. This is one of the areas that we're really focusing on. Now we have about 9 AAC specialists, but that's an area that I feel like it changes so much, it's kind of hard to stay up with it. So we really just have one person that just kind of follows it and keeps the team up, and then we have monthly meetings to make sure, not monthly, they're weekly with the tech team to make sure where it's cutting edge. But there's eye gaze, there's so many different programs out there, and there's a lot of options. So, yeah. And that was one of the things that I wanted to touch base, but that I was always afraid to give Cody an AAC device because I thought then he would stop talking. But all the research shows that that is not the case. So try to get beyond that, because I know it's hard. Anyway, it was for me. Okay, hyperbaric oxygen treatment. It just increases the oxygen to the brain, basically. It goes into the brain, the blood, and then it brings it up to the brain. So it's really hard. So we have this in one clinic. I don't have it in the other clinics yet. I think with the hyperbaric oxygen, it's really hard to prove that, or with research, that it works. I took my son to Florida, and Dr. Neubauer, he was the pioneer. First, it took me $10,000, and did he get something out of it? Yeah, he got his speech improved a little bit, his balance a little bit, and like one of his eyes, I could see that, because he had, one of his eyes would go out in a strabismus, and it brought it in just a little bit. So it was like, I knew that it did something for him. So basically, when we were saying how to choose the right therapy for your child, I was trying to do everything, and I had to look at, okay, what am I doing? I was going to Poland, I was doing a hyperbaric, I was doing, and I had to look at it and say, what is working the best, and what should I focus on at this point? So, I mean, I'm sure you guys even have much more difficult choices, because with the internet and social media, there are so many different things out there to try these days. But I think the best people to ask of would be your social media, your colleagues, on what's working for you, and things like that. Sorry. Next one. Other therapies and techniques, Annette Benell method, Feldenkrais. I don't have a lot of time to go through each of these, but the best thing to do is research them, and then find out who's done them, and try to talk to those people. So how to choose which therapy is right for your child. One of the things that we do when we do an intake, so if we get your intake, it goes to the therapy teams. So we have the lead therapist that they all read over it, and they say, okay, what should we do, with this child? And but what I was saying before, you kind of follow your heart, where your best instinct, where you should go, and then if it doesn't work, don't keep doing it. You find something, you try it, and move on. Because I know there's been things that I was stuck on, part of the Institute's program, which it's a program where it's a home therapy program. So I had 60 volunteers. Cody was in semi-comatose when I started it. And it's very cognitive. You do reading cards, you do flashcards. It's sensory. You do hot packs, cold packs, brushing. Every minute of the day, he was worked out. We did patterning, 15 sessions or 18 sessions of patterning, which that would be one person at the head, 2 on each side of the body, and we just programmed that brain. Glenn Doman found that a child that wasn't crawling, that they had problems with reading and everything else throughout life. And so that's when they went back and they researched what do well children do, and he started doing this with brain injured children and found that you could complete those pathways. And that's the same with brain gym as well, so you can do brain gym as well. Approaching your physicians. So When you go to your physician, don't say, I'm going to go try this new therapy, or I'm going to go try this new CME, and I want to do this intensive program. Just remember, these are just tools. So you may be going to, do some CME, which is physical therapy done by a physical therapist, or a therapy done by a physical therapist or occupational therapist. Make sure you're stating it is therapy, because a lot of times that's when you're going to hit roadblocks all the time. So just make sure you remember these are just all tools, and everything that's done with the vital stem, with all of it, are done by licensed therapists, and that's how you approach your physicians. These are therapists. Okay. Do you have any questions? Yes.
At what age do you typically start these types of therapies?
So that's a very good question. So we've had children as young as 9 months. Would we do 4 hours? No. So, usually, I would say typically between the ages of 2 years and 3 years is a good time to start.
So we're too young.
Pardon?
So we're too young.
I
We have a 10-week-old son.
Okay. So the best thing to do is, if you're interested in the NAPA program, is to fill out the intake, because if our therapists think that he or she, is too young, they will tell you shouldn't come for 6 months or whatever. But we do get them very young, especially if we're working on head control. If I were you, I would go. I would go even if NAPA told you shouldn't. That's the parent in me. We do have those parents that'll do that too, So we do have a clinic in Sydney, Australia, and that we opened up 2 years ago, and we really had to see if we could duplicate what we did. We know that what we do at NAPA is amazing. We see about 300 kids a day in LA now. We have a staff of 70. And Sydney was like our really test market to see if we could do it without me being there. Because, I really felt like the reason NAPA was successful because I was a parent. And I was the one on the floor that, no, it's not, here, I'm going to get the ball. And not saying that there's bad therapists out there. But we work kids really hard. It's totally different. And so there are other people out there that are doing intense therapy. And you know what? You have to do what you have to do. So you go where you need to go to get what you need for your child. But we are opening up Boston, and April 30th is our opening, and so we're very excited about that. So we are planning on, so right now we did the first clinic, and then it took me 2 years for Sydney, and now 2 years for Boston. We're trying to get it quicker because I do know there's a need out there, but we got to keep the quality of the therapy up, and so right now my Boston people are already in the U.S. training. So I went off there. I didn't tell you about Boston before, so I had to. Any other questions? No. All right. Thank you so much. I do want to tell them there's flyers out. There's the PowerPoint presentation out on the table, and also flyers, NAPA books. Did I get it all? Thank you.
So I wanted to say thank you to Lynette, and that we highly encourage anyone who's interested in her program to take her flyers, to contact her and her staff. And you can also go on our Facebook pages, and there's a lot of families that'll give you responses of their experience. We have sort of a help group that'll give you your experience at the NIH for a week, and we have help groups in social media that'll give you your experience at NAPA for their week there, or 3 weeks there. So I just think it's fantastic for Lynette to come all the way down when all of her staff were up at the Abilities Expo. We had conflicting weekends, but she was able to come down and spend the time with us, and we just really appreciate it. Thank you.
So there's also a flyer out there that we're doing the first annual. We also have a nonprofit. That's what we do in our spare time. But it's a Neurological Innovative Summit. It's the first. And I don't know if any of you have heard of Chris Ullman, the Special Books for Special Kids. Have you heard of him? He will be the keynote speaker. We'll also have Dr. Ingby there, who does the selective subcutaneous myofascial lengthening, and 3 other physicians, which they'll be on the other flyer. But it's an IV specialist. Okay, thank you.
Now it's my pleasure to introduce one of the very key individuals who helped make this conference happen. Kerry Austria has had many different hats. She still wears many different hats. She's conference organizer, yeah. I can't even recite her entire resume, but right now she's the executive director of NGLY1. And Kerry is here. She has many years of experience working in advocacy for global genes before her current position, and so we're very honored to have her here to talk about advocacy, which is what we are ready to do after this conference, because we have the energy and the motivation from all the families. We've heard the professionals tell us it's the advocates, it's the families who have the power, and Kerry's here to tell us how to do it. So welcome, Kerry.